going to start from the beginning here. So this slide presentation came about from a talk with EMS providers who wanted some more specifics about what to look for and what to be concerned about with carbon monoxide poisoning. And so this is a response to that, and you can sure use it at your discretion. So when talking about carbon monoxide, it's a colorless, odorless, and tasteless gas, most commonly produced by combustion of organic materials. So whether it's a fire or burning some kind of fossil fuel. Most fatalities result from fires when it comes to carbon monoxide toxicity and poisoning, but stoves, portable heaters, and automobile exhaust are very common sources for carbon monoxide. It's seen more commonly in this part of the world from improper ventilation in the cold climates. Carbon monoxide toxicity causes a cellular level oxygen delivery and utilization problem because of binding of carbon monoxide to hemoglobin, and then the subsequent binding of oxygen is affected by that and shifts the dissociation curve to the left. The greatest impact is on the most oxygen-dependent tissues, which, not surprisingly, are the heart and the brain. Carbon monoxide binds to hemoglobin at about 230 to 270 times that the affinity of oxygen. This binding is reversible, but does cause cellular hypoxia because of this decreased oxygen delivery. It binds a hemoglobin molecule, resulting in carboxyhemoglobin, and this carboxyhemoglobin can be measured in the bloodstream. The binding causes an increased binding to oxygen in the other three sites on the hemoglobin molecule, and this in turn shifts the dissociation curve to the left, causing increased tissue hypoxia and decreased availability at the tissue level. So those areas that are more prone to problems because of carbon monoxide poisoning and toxicity are the cardiac tissues. Carbon monoxide binds to the cardiac myoglobin as well. This cardiac myoglobin binding does cause some myocardial dysfunction and hypotension, and can contribute to more profound hypoxia in those who are carbon monoxide toxic. In the brain, carbon monoxide has been shown to cause brain lipid peroxidation and leukocyte-mediated changes in the brain that lead to inflammation. This may be decreased by hyperbaric oxygen therapy. Carbon monoxide toxicity symptoms of carbon monoxide toxicity include headache, weakness, dizziness, nausea and vomiting, shortness of breath, confusion, blurry vision, or loss of consciousness. Headache is the most common symptom. Those who are most likely to succumb to carbon monoxide poisoning include those who are intoxicated and have a tough time knowing that the symptoms are not from alcohol use, or those who are sleeping and succumb before they get a chance to be fully awakened by symptoms. There are those who are at higher risk for problems because of carbon monoxide poisoning, and they include those who are pregnant, those who are underlying pulmonary and CV disease, and irreversible brain damage can occur before anyone realizes there is a problem when it comes to carbon monoxide poisoning. Hyperbaric oxygen therapy is indicated for patients at increased risk for serious sequelae, including those with heart disease, those who are pregnant, or those who are experiencing serious neurologic symptoms, such as confusion or loss of consciousness after exposure. There is also this delayed onset neuropsychiatric syndrome, which can express itself with prolonged mental status changes that result after severe symptoms from carbon monoxide toxicity. There may be some benefit to hyperbaric oxygen therapy for those patients, and so in anyone who has neurologic symptomatology, hyperbaric oxygen should be considered. So in terms of treatment for carbon monoxide poisoning, hyperbaric oxygen, if available, is one of the first line choices. It decreases the time to normalization of oxygen and carboxyhemoglobin levels in about 30 minutes. However, 100% oxygen also does decrease the carboxyhemoglobin level and return oxygen levels to normal, but it takes about 90 minutes with 100% oxygen per mask. So if available, hyperbaric oxygen therapy would be first choice, but if not available, high flow oxygen by non-rebreather mask would be of benefit. Carboxyhemoglobin levels can vary. In the normal state, typically we see carboxyhemoglobin levels of about 2 to 4. They can be up to 15 in smokers who smoke regularly, but levels commonly seen in the ER oftentimes exceed 20s to 30s. The point to remember with this, however, is that the numbers do not necessarily correlate with degree of impairment. Oftentimes you can have a lower number and have more neurologic impairment and more potential sequelae than someone who has a level greater than 30 but did not lose consciousness or have any neurologic symptomatology, just a headache. So the levels do not give any clue to who should be treated necessarily and should not be waited for to decide upon treatment. So with carbon monoxide poisoning, who to treat and consider for hyperbaric oxygen therapy? Number one, those who have serious neurologic symptoms such as loss of consciousness, increased confusion, and this should be used regardless of carboxyhemoglobin levels. Those who are pregnant or cardiac patients should be considered for hyperbaric oxygen therapy if available. And all patients who have carbon monoxide poisoning should be treated with oxygen by mask, 100% oxygen by mask at and this treatment should last for at least an hour to an hour and a half. After about 90 minutes, most patients will return to baseline in terms of carboxyhemoglobin and oxygen levels. They should be followed in the hospital or ER until their symptoms have also completely resolved, and they should not be returned to any environment that has increased carbon monoxide levels. So in summary, you should suspect carbon monoxide poisoning and treat all suspected with oxygen by mask at 100%. And based on the potential situation where carbon monoxide poisoning might be an issue, the decision to start with oxygen therapy should be initiated early. You should consider hyperbaric oxygen therapy in high-risk groups, such as those with neurologic symptoms, those who are pregnant, or have cardiovascular or neurologic disease. And carboxyhemoglobin levels do not correlate with disease severity and recovery and should not be used to determine length of treatment or who to treat with hyperbaric oxygen. Thank you. Thanks for your attention, and hope this is helpful.